Welcome to the $11.99 SEIU Wellness Map Prenatal Program. I'm Abbe Kirsch. I'm a certified nurse midwife, and I've been working with $11.99 in the prenatal program for about 15 years. Today we're going to talk about AMI in labor. Signs of labor can be lightening, which is the lowering of the baby in the pelvis, Braxton-Hicks contractions that get stronger, which means that your belly gets really, really tight, might go around your back, might just be really tight and heavy, might be painful, might not, but they're getting closer together. You might notice mucus coming out of the vagina. It can be in clumps or just a lot. It could be yellow or it could be bloody, which we call bloody show. And the bloody show is when the blood vessels break as the cervix is stretching. Or you might notice or think that you broke your water. Let's talk about some of the signs that you'll experience when you really are in labor. Lightening. Lightening is when the baby actually moves down in your pelvis. We call that descent, and it happens a lot during labor, but before you're in labor, you might notice that all of a sudden you can breathe easier and you don't have as much heartburn and you can take a deep breath, but you have to go to the bathroom more frequently because there's a lot more pressure on your bladder. You might also experience some nesting, like this burst of energy where you want to clean and organize, and that is just an early sign that labor is going to be coming. Another sign that you might have that is an early sign of labor is noticing your mucus plug. Your mucus plug can come out and you can notice it as like a yellowish, goopy substance that comes out. It might be real stretchy or just really clumpy. You might notice it when you go to the bathroom or you might notice it on your underwear. And that is absolutely a normal sign that doesn't cause any concern because that is supposed to come out in order to make space for the cervix to start opening. If you're noticing or thinking that you're having contractions, what you're really going to feel is that your uterus, or really your whole abdomen, is going to get really tight. You might notice it's heavy, you might feel more pressure, but it's something that comes and goes away. It's not constant, it's intermittent. And it can happen frequently or it can happen every now and again. And you might experience it in the last months of pregnancy. You may or may not. If you're feeling it during the end of pregnancy and it comes and goes and comes and goes, that's okay. That's really normal. It's just practice. We call them Braxton-Hicks. But when you're around your due date, we like to think that term pregnancy is after 37 weeks up to 42 weeks of pregnancy. When you're feeling the contractions that keep coming, that you feel the tightening in your belly, might wrap around your back, and you might feel that low back pain. You might have pressure in your pelvis, and it might be painful. And if it keeps coming more and more frequently, lasting longer, getting more uncomfortable and painful, it is likely true labor. The real way to know if you're in true labor is if your contractions are keeping coming, they become regular, where you have them every few minutes. And while it's important to know how frequent they are, contractions can be counted from the beginning of one contraction until the beginning of the next contraction. And how long they last is less important, but the frequency that they're coming every few minutes, not every 20, 30 minutes, but if they're getting closer together, that's how you know that this is most likely labor. The definition of true labor is when you're having regular contractions and it's actually helping your cervix change. There's 3 things that happen that is really considered progress in labor. Is the cervix is going to dilate, and that's when it opens. It stretches from being closed, and it goes all the way to what we consider as 10 centimeters. But really, it depends on the size of the baby's head, because you're fully dilated, you're completely opened, only when there's no more cervix in front of the baby's head. The baby will also descend in the pelvis. Some of it might have happened during lightening, which is early, but during labor, every time you have a contraction, pushes the baby down more in the pelvis. The other thing that happens to your cervix is it effaces, and effacement is when it's stretching and thinning. What happens is that the uterus is a big, big, strong muscle. I mean, it grows 20 times its normal size for pregnancy, but in labor, the top part of it will squeeze, get really, really tight, push the baby down, cause a pulling of the cervix, which can help it open and thin out. And both of those things can happen during labor. So we look for progress of labor from having contractions, cervix is opening, cervix is thinning, and the baby's head is moving down in the pelvis. All those things can happen, and you might not even know what progress is occurring until you are evaluated from your healthcare provider. You've probably also heard of bloody show. Bloody show is when that mucus plug comes out while the cervix is starting to dilate. The cervix is full of capillaries, which are these tiny little blood vessels. And the blood vessels will break when the cervix is stretching. So what you'll notice is some bloody mucus coming out, and that's very different from like blood like a period. If you're having any blood like a period, that's a warning sign, and you really need to get that evaluated. But if you're noticing some discharge that has blood in it, that's actually a very good sign that your cervix is starting to change. Another thing that can happen either before labor begins, during labor, or even during the birth of your baby, and that's when you break your water. We call it breaking your water, but it's not really water. It seems like it's like a water balloon, but it's called amniotic sac. The amniotic sac has membranes around the outside. It surrounds the baby. It's attached to the placenta. And inside the membranes is the fetus connected to the umbilical cord, which also connects to the placenta. So at any point, either before contractions start or any time during the process of labor, that sac can break and you will have leaking of amniotic fluid. Sometimes it comes out like a big burst and you'll notice like, wow, what just came out of me? But sometimes it's just a slow leak that you're gonna question if it's really your water breaking. And the way to really know if your water is breaking is to go to the bathroom, empty your bladder, make sure that your panties are clean and dry, get up, walk around, and notice if you get wet. If you continue to feel wet, you probably broke your water and you should come in and get evaluated. If you think that you're in labor because you're having contractions or your water broke or you're noticing a lot of bloody show, you want to go in and get evaluated by a healthcare provider. What happens when you go in to be evaluated is they're going to examine you. They're going to first do your blood pressure, find out how far along you are in pregnancy, ask you about the symptoms you've been experiencing, maybe check your urine, and they're going to go ahead and put you on a monitor. The monitor is going to evaluate the uterine activity, which we consider contractions, and the fetal heart rate to know what the pattern is like. How is your baby doing? You're also possibly going to have a sonogram, and you're most likely going to have a vaginal exam. Sometimes if we're trying to figure out if you broke your water or not, you'll need an exam with a speculum so we can take a look and see if there's a pool of fluid right outside of your cervix. But often we'll just need to do it with our fingers to feel your cervix. And by doing a vaginal exam, we're going to be able to feel if the cervix is opening, if it's thinning, and we can find out where the baby's head is in the pelvis. Once we've determined if you are in labor or not in labor, or even just in early labor, we can then make a plan of how to go ahead and take care of you. Sometimes in early labor, we'll go in for an assessment and it's very early in labor and you'll either be asked to walk or you'll get sent home to come back when it's a lot stronger. If you're really in labor, you might get admitted and get a room, and best to have your support people available for you to give you a lot of support during labor. Thank you so much for joining me today to learn about Am I in Labor? I hope it's helpful for you. Stay tuned for more topics in the series.